So who's this?
Boy, this is Shady.
All right, Shady.
Shady has a lot of anxiety. Easy. Buddy, you're okay. Your girlfriend's right behind you. You're okay. See, that's weird. Good buddy. Good boy. Good boy.
All right.
That's it.
There we go.
Easy.
Let the magic work.
Good boy. Want to take a couple steps up here so we don't have so far to go? That's a good idea, huh? Perfect.
I like the fact that you stayed on my shoulder. That's an experienced person there.
Thank you.
I have to explain that to a lot of people.
Right.
When I'm working on it. If you're holding them for me, you stay right here.
Sure.
That way, if the horse moves, we're on the same side.
Right, exactly. Yep.
We can stay in the middle of the stall, or we can spin together if we have
Right.
to.
It's a dance.
We'll do the little dance. You don't want to end up on opposite sides of the horse.
Nope.
Because sooner or later, somebody's going to be pointed at the button.
Yeah. Good boy. What are we thinking? Dirty dog.
You know, rubbing elbows.
There we go. I want to say 7, but I have a little chart in there. I can tell you for sure.
Ballpark's good.
And we're drunk.
All right.
Let's go for a walk, buddy.
Come
Come on. Step up. Good boy. Good boy. Good boy. Good boy, buddy.
Good job.
Good job. Good boy. Good boy.
All right. We'll let you just sit there and get comfortable for a minute. Bumps, and a lot of times just kind of running my fingers and feeling things. Sometimes your fingers will tell you something where your eyes have a little harder time picking up on stuff. The top of their teeth, their top teeth are right here, and if you run your finger right here, you can actually feel the outer edge of those teeth. So even before you get in their mouth, sometimes you can tell, oh, I got a missing tooth there, you know. Your finger will kind of drop into a hole. I'm on the bottom of the jaw. I'm usually feeling for any kind of lumps and bumps that don't belong. So far, everything's good on him. Next thing we'll do here is take a look at these incisors, and what I want to see is a nice straight bite across the front. He's pretty level there, so that's pretty good. Teeth match up fairly well. We don't have much of a overbite or underbite or anything going on there. He's a gelding, so he's got some visible canines here, and they're nice and they're a little worn on the crowns, which is very common, but they're nice and tight. They're not wiggling. There's no signs of gum disease. Next thing I do when you see me sticking my thumbs and stuff in here and fingers is I'm feeling the bars of the mouth. And a lot of horses will sometimes you'll find little scar areas where little bony scars where if they've had biting injuries or something you can kind of feel. Sometimes I'll feel active lesions, like they'll be swollen. You know, they'll have some soft tissue swelling there. A lot of horses that are actively in training and maybe can be a little hard-headed, or maybe the trainer's a little hard-headed. Sometimes you'll pick up on a little swelling in the bars of the mouth there. Hopefully it's a temporary thing. Everything feels pretty good there. So I have a little mental checklist that I go through on the outside, and then once I get back past the bars of the mouth, then it's time to get the speculum out, take a look at the cheek teeth. And for most horses, this is usually where the rubber meets the road. I mean, this is the meat and potatoes of the exam. The cheek teeth are where all the food is processed. A lot of times, if they've got something going on in their mouth that's painful for either chewing or riding, a lot of times it's coming from the cheek teeth area.
And this is something obviously most horse owners can't crank open their horse.
Most of the time, you're not going to get a real good look at the back.
Or really know what you're looking at sometimes.
Now, some people will kind of stick their fingers in the side and feel along the side edges. Depending on how brave you are. And in some cases, you know, for a long while, and unfortunately some still do it, some vets will kind of just run their fingers in and tell you whether or not they need to be floated. But the problem with that is unless you've got a finger this long, the only teeth you're going to feel are these first two right here. And it's been my experience that if a horse is uncomfortable, it's not usually the front teeth, it's usually the back teeth. that are actually causing abrasions and things like that. So unless you're getting back there and feeling them and looking at them, you're missing the important part. You know, these points are probably uncomfortable when he's trying to chew, so getting in there and getting them floated will certainly make him a little happier.
His points are really sharp and back?
They're pretty sharp, yeah. He's got a few little lesions. He's got
like sharp enough to actually cut. Like,
can you see?
They can, yeah. It's hard to kind of
probably
get
not.
it to where the camera can see it. But
right.
if you look over my right shoulder across his mouth, in the very back, you'll see some dark spots along the cheeks back there. And those areas are lacerations and little abrasions on the cheek back there.
Yeah. Huh.
So that's
Poor
the type of
guy.
thing that those sharp points can cause.
Okay.
And it can leave them pretty uncomfortable. So the floating that we do, which is kind of the routine thing that we do, that's what we're doing, is we're trying to get rid of those sharp projections out there, so that we just try to make their whole mouth a little bit more comfortable for eating and riding and stuff like that.
But even just handling. I mean, if he doesn't feel good,
well, I mean,
his
it's
attitude
just like
changed. Not that
if you had a toothache or a mouth that hurt you, you're going to be pretty grumpy most of the time. So yes, I've had some horses that just kind of their whole attitude seemed to kind of improve after we did the float and got them more comfortable.
Yeah.
But if you look at him straight on, can you see how his teeth kind of slant there? That's called a slanted bite or a diagonal bite on there. A lot of times it's not a big deal unless it interferes or causes some asymmetry in how they move their jaw. So that's one of the things I check when I see that diagonal bite on them. He's not too bad, but he's got a little bit of asymmetry. So what I'm going to do is on this long side up here and a long side down here, I'm going to reduce the crowns on those just a little bit, just to try to, I'm not going to level it, but we're going to try to reduce the effects of that diagonal bite. What we have found is that over time, trying to just totally level them, unless it's just a very slight diagonal, is kind of counterproductive.
So this is something you're doing gradually over time?
Yes, but it's going to be a maintenance thing. It's not going to be something where the goal is to try to have a flat level bite. I think he's got enough of a slant there that I think it would be unrealistic to try to expect to try to get it level. And in some cases, you don't really want to level it, because there's a reason that diagonal bite is formed. And in many cases, the reason is because the bone structure is slightly a little off. And if you force them into a level bite, you're going to cause some pressure and stress on certain areas of the bone that their bones are kind of not really aligned to do. It is as they have permanent teeth coming in and baby teeth coming out, there's some downward pressure on these forming permanent teeth. And they'll kind of push downwards as well as upwards. And so they kind of push this thin layer of bone out a bit. This is very normal. If it's symmetrical on both sides with no heat or swelling or discharge, I usually don't worry about it.
And hers is?
Hers is.
Can I feel it?
Yes, absolutely. It's just hard, just like bone.
So this is not actually bone?
It is bone.
It is bone.
It's a thin layer of bone that's over the tooth that's pushing down.
Got it.
Now, most of the time, by the time they hit 5 and certainly 6 years of age, usually that has remodeled itself and is nice and smooth. But between 2 and 4.5, 2 and 5, it's pretty common to see that. She's got some sharp points going on in there, a few little minor tissue abrasions coming from those points. She still has her last molar that will come in, but usually they're 3, so she's a little bit early on that. She's got some pretty good sized wolf teeth in here. Now, wolf teeth are kind of one of those things that they sometimes cause a problem, sometimes they don't. It doesn't hurt anything if you want to wait and see. We can take them out at any time. And her wolf teeth are actually pretty big, and they're fairly stable. The ones that I think probably cause the most problems are the ones that wiggle. And hers are not wiggling. So what I'm saying is I can either take them out today, or we can wait and see if they seem to be a problem, and I can take them out at any point in the future if you feel like they're an issue. Those in all likelihood are canine teeth. And she just doesn't have much of them, and what she's got is kind of migrated right here real close to these incisors. They probably won't ever cause a problem. If they get loose, you can pop them out pretty easily. Ones like that don't have much of a root on it. Regular canine teeth can be a real bear to get out, because they have horrendously long teeth or roots, but ones like this are kind of almost vestigial. They're just not really there. A lot of mares either don't have canines or they have underdeveloped canines versus the geldings and stallions. So right side, he's got kind of a firm lump here. And underneath it, I mean, the soft tissue is kind of stretched a little bit there too. Underneath it, it feels like it's fairly firm, like bone almost underneath there. And it's possible that could be some scar tissue. In other cases, you can have a little bony growth there that might be a spur, or it could be something more like granulation tissue, or even in rare cases, you might have like a little bony tumor or something that's kind of growing in that area.
Okay. So his right.
And the right bars of his mouth on the lower side down there. I don't feel a lot of soft tissue swelling per se, but the tissue itself is kind of stretched over this area.
Okay.
This is something I probably would recommend, unless it's something that she knows she's been dealing with and she kind of knows what's going on. I would probably recommend getting a radiograph of that at some point.
Okay, I will definitely let her know.
Just to see, on the off chance that it is something growing and active,
okay.
If you can catch it early, you might be able to intervene and maybe even excise it or something and kind of get it out of there.
Okay.
All right, well, she's got a few little uneven spots along her cheeks or along her cheek teeth back in here. They're called waves, and it's where the surface, the crown height of the tooth varies a little bit as you go from front to back. Hers are not bad, they're kind of medium, and they're a very gentle wave. It's not, some of the ones that really go up and down seem to cause more problems than ones that are kind of more of a gentle arc. Late teens, you told me on her?
Yes.
I'm probably not going to be super excited about doing a lot of corrective work on her, because what happens is in their early 20s, the reserve crown that they have below the gum line, they run out. So those teeth quit erupting, which means that if I reduce the crown on a tooth, it's going to stay that way. And when I'm doing this corrective work in there, I'm really relying on the short teeth to come up in. But if they're out of that reserve crown already, then that's not going to happen. So I get a lot more conservative the older they get on making corrections to these teeth, especially if they're really not that bad to begin with.
Right.
So she's got a few little hooks and things, a little overlong spots that might be uncomfortable for her. She's got some sharp points. We'll go ahead and get rid of those. But as far as the waves go, I'm kind of inclined just to leave them alone for right now. Now, if I check her again next year and I see those waves are getting worse, then we might kind of make some little small adjustments to them. But they're kind of medium sized and they're very gradual, and I really don't think it's going to affect her bite in the long run. I think she'd be better off to go ahead and leave that crown in there and leave the content. This particular one has got little diamond grit here, so it's kind of a rough surface that is pretty forgiving on soft tissue. If you happen to just rub it against the soft tissue, it's not going to really hurt it. You'd really have to push hard to really hurt soft tissue. But when you put it on the tooth, it works really well to remove those sharp edges. This is a specialized one that I can kind of get to the back of the mouth pretty well with. The question I always get is, does it hurt? You know, and because people always think about the dentist drilling on their teeth.
Right.
And it's really not the same. Horses' teeth are made to kind of grind down. And what I'm doing here is really no more than what they usually do. I'm just doing it a little bit more in a targeted manner.
Right.